Hi, everybody. Good evening, Democrats. My name is Mark Gonzalez, chairman of the LA County Democratic Party. And I want to thank you all so much for taking the time out of your evening to be with us to talk about one of the most pressing issues we are facing today in our state and in our country. And if we've learned anything from COVID-19 pandemic, it's that it's long past due to fix our broken and discriminatory healthcare system. About 2.7 million Californians are uninsured or underinsured. And many of you know my story. You know how I grew up. I've explained it to you when I ran about how healthcare was something that was a luxury and not a necessity for me. So this is also something that's not just a fight in the Democratic Party, but it's also something that's personal to me and why I'm standing up for this and for all of us working with all of you together today. Now we have the opportunity to take critical steps towards ensuring every Californian has access to health care with the introduction of AB 1400, the California Guaranteed Health Care for All Act, CalCare, by Assemblymember Kalra, Assemblymember Santiago, and then Assemblymember Kamlager, among others. Under AB 1400, every California resident would be guaranteed coverage with any provider of their choice without the barrier of enormous premiums, deductibles, or copays. California is the 5th largest economy in the world. And if we are to guarantee health care for our entire state, we could demonstrate that guaranteed health care is fiscally sound, produces better outcomes, and is a public safety imperative. I was proud to author our LACDP resolution supporting single-payer healthcare in California, which earned unanimous support of the Los Angeles Central Committee. And special shout out to Jenny Chang, Betty Tomas Toto, Jason Small, and so many others that I worked closely with on this issue. LA Democrats know that we need bold, thoughtful action here in our state, ensuring that every Californian has access to good quality healthcare. And I've challenged, and I'm proud to have challenged all 57 other central committees to join Los Angeles in this fight, and many are already following suit. Tonight, to discuss how we move forward as a state, we're honored to have to join us 3 amazing legislators. We are privileged to have Assemblymember Miguel Santiago with us on tonight's panel, representing the 53rd Assembly District, who is also a member of the Assembly Health Committee. In the legislature, he has fought to help unhoused Californians, build affordable housing, protect communities from pollution, and has led the effort to make community college free. Since the pandemic started, Assemblymember Santiago has helped distribute thousands of free meals and fought to protect renters from evictions. He is currently working hard to pass AB 1400, which is why he is here with us tonight. We're also excited to have newly sworn in Senator Kamlager with us. Kamlager champions creating equitable, safe, and stable communities, specifically by advocating for universal health care access, affordable housing, and criminal justice reform. During this past year in the pandemic, legislators across the county and country have really been put to the test. And when push came to shove, Assemblymember Kamlager fought to pass the COVID-19 eviction moratorium and the COVID-19 Tenant Relief Act and worked to supply PPE to frontline workers. Now that she's elected to the Senate, she is committed to ensuring that relief and recovery is fast-tracked for California families and businesses. And last but not least, we welcome Assemblymember Kalra, author of AB 1400. He's been representing 8027 since 2016 and has worked on a number of assembly bills since then, focusing on improving healthcare and access to healthcare, including AB 2180, which improves long-term care insurance, AB 3211, which improves the use of advanced healthcare directives and organ donation, and AB 2455, which ensures protection of and support for home care aides. Besides his work on healthcare, he has worked on a number of issues, including criminal justice, affordable housing, and transportation infrastructure. And he also chairs the State Assembly Labor and Employment Committee. But before we start our panel, I would like to bring on a dear friend, Insurance Commissioner Ricardo Lara, for a brief welcome. Insurance Commissioner Lara believes affordable healthcare should be within reach for all Californians. As state senator, he authored the Health for All Kids Act, which now covers 250,000 Californian children with full scope Medi-Cal regardless of their immigration status. And he supports efforts to continue to reduce the number of uninsured Californians and strengthen our public health system. Welcome our Insurance Commissioner, Ricardo Lara.
Thank you, Mark. It's great to see my fellow LA Democrats. I want to just take a moment to, first of all, thank Sydney, Ash, and Miguel for their courage to bring this critical issue forward. As your California Insurance Commissioner, I'm proud to stand with them and support this critical legislation that's going to continue to get us to a point where we finally get to a single healthcare payer system. As many of you know, when I was in the state Senate, I authored SB 562, our single payer healthcare bill. You know, healthcare now more than ever, as Mark was saying, with the pandemic, I'm seeing firsthand the inequities that exist in our healthcare system and how millions of hardworking Californians continue to get left out of something that is so basic and critical to our human existence and empowerment. If children are sick, they cannot go to school. If parents are sick, they cannot work. It affects our economy. And so I know we are at a critical moment. I'm proud to have led these efforts, but more importantly, I want to thank all of you, all of our Democratic activists and loyalists. We stand on your shoulders. The reason we are here fighting this fight is because many of you have been in this fight for years, long before we came along. But your efforts were critical to allowing me, somebody that grew up without healthcare, with two undocumented parents in East Los Angeles, that had to travel to Tijuana to receive our care. Unfortunately, this still happens to so many of our county residents. And so on your shoulders we stand. I want to thank again Sydney, Ash, and Miguel. I'm here for whatever you need. I will lend you my staff, our support, our expertise within the Department of Insurance to get this done once and for all. It is truly a shame that California, the most powerful state in the union, has not been able to get this done and passed in the legislature. It's going to be a big fight, but I'm with you. Estoy con ustedes. Felicidades. Let's get this done. So many people are depending on this. Our undocumented community, our working families that depend on this to be able to get their families moving forward. So I'm just proud to be here as just one more supporter of this legislation and a proud LA County resident, proud of my party and my Dem party that are leading the efforts. So thank you again. I look forward to this discussion and to a fight, because it is going to be a fight. And you all know that nothing comes for free. Everything that we've earned and all our civil rights, we earned through a fight. And we're ready to fight and stand with these amazing progressive leaders to get this done once and for all. Thank you again. And I appreciate all the support and love you're going to give to our assembly members to get this done. So muchas gracias. And let's get out there. Let's fight. Let's win, because that's what we do as LA Democrats. Thank you.
Awesome. Thank you so much, Mr. Commissioner. If we were all together in a rally, I'm sure we'd be going crazy for you, superstar. We really appreciate you. And thank you so much for your commitment, Commissioner. You've always been at the front lines of this issue. So we really appreciate your work and for even coming on. I mean, you called me and reminded me of those efforts. And it's really important to have you as a partner who's also the president of the National Association of Latino Elected Officials, which is huge in pushing this issue at the forefront of the United States, simply. So thank you so much. So let's go ahead and get started with some of the basics. So we're going to go ahead and these first question is for all three of you. So how would a single payer system work? Would a California single payer plan replace the Affordable Care Act, or would it supplement it? And so that usually is something that folks get confused about. So we'll go ahead and start with our Senator Kamlager on that question.
Well, thank you for that. And thank you for actually starting with me. But I want to actually punt, if possible, to Assemblymember Kalra, since it is his bill. I want to give a shout out to Insurance Commissioner Ricardo Lara, because he has been a stalwart champion for healthcare access. He was doing it when he was in the Senate. And then actually he was also doing it, and he has been doing it as insurance commissioner. He and I are actually partnering on a bill. So if you don't mind, just because I try to be diplomatic to the authors of the bills, I'd like to have Assemblymember Kalra start off.
Absolutely. I'm ladies first mentality, but
I appreciate you. I mean, I will say, I will say, just to sort of cue it up, that this is going to be, I think, the fight of the legislative session. Everyone seems to be, conceptually enthusiastic about healthcare for all, about single payer, about some kind of change to what we currently have in place. And a number of folks are talking about the funding mechanisms and what will it look like. And some people are beginning to get curious and maybe a little concerned about if they would use their coverage, especially those that are in the public sector system. What we do know is that by passing AB 1400, we would be able to position ourselves to see consolidated federal waivers. And that is something that is a new element to the discussions we are now having about single payer and universal health care that maybe wasn't part of the discussions happening years before. And so we are looking to create something that A, will work, that B, can get implemented, and that B, will be financed. That is why also part of this is the CalCare Trust Fund to allow us to be able to harness the resources to make that happen.
Absolutely. So let's punt it to
yes.
on that.
I mean, she carried the ball for quite some distance there before punting. So I appreciate and I love saying Senator.
I'm just proud that I know football terms. But
I love saying Senator Kamlager. It really sounds great. As much as I miss you, appreciate you for everything that you're doing and have done and will continue to do as our ally in the Senate. And certainly appreciate our insurance commissioner. I really will take him up on resources that his office can expend in terms of research and staff work, because I've literally spent hundreds of hours in reading up on healthcare, and it is complicated and complex, and that leads to some of the fear. So when we talk about what a single payer program would be, what we're talking about is everyone in, no one out. Right now, I think all of us as Democrats believe healthcare is a human right. Well, right now we are denying a human right to millions of Californians, either because they don't have health insurance at all, or because they have inadequate access to health insurance. Even if they have a health insurance card, the copays, deductibles are so high, they don't take advantage of the healthcare that they purportedly have access to. And so, when we're talking about a single payer system, we're not talking about government control of healthcare. The providers will still be both public and private, just as they exist now. It's the paying system. Right now, we have a very complicated multi-payer system that allows for profiteering to a degree that you don't see anywhere else in the free world. And so what we want to do is have a single payer system that has cost controls in it that allow for us to actually ensure that when we're paying, it's going to those providing the care. It's going to the doctors and the nurses. It's going to the techs and the nurses' aides and the physicians' assistants. It's going to the janitors in the hospitals and the cooks that are cooking in the cafeteria. It's going to those that are essential as part of providing care. Now, to your question on ACA. So, and Sydney spoke a little bit about waivers. So one of the waivers that would be necessary is essentially an ACA waiver. It's a Section 1332 waiver. And so it is, so basically the funding that comes in, and Sydney talked about consolidated waivers, that would include Medicare, Medi-Cal, CHIP. It would also include ACA waivers. And so what we're talking about is a consolidation of a number of waivers, including ACA waivers, that allow us to get all, because right now about $200 billion of funds for healthcare come already from federal and state funding from different sources. We want to consolidate all those funds and allow them to be used in a single payer program.
Absolutely. And in LACDP, we passed that resolution, and obviously going to the legislature on that. So we appreciate that. So Member Santiago, if you can kind of wrap that piece of it up, on the basics of it, would a California single payer plan replace the Affordable Care Act, or would it supplement it? Just kind of the basics of that.
Sure, no, absolutely. And where Kamlager Dove took it down the line and Kalra now scored, I will be the one who picks up the ball and throws it back so we can do it all over again. Well, here's the bottom line, I think. And, you know, what I want to emphasize really, this is one piece of different pieces that have to happen in order for us to implement the single payer piece. I think what's critical to understand is this is a serious public policy debate, and it basically breaks up into 4 different pieces within the bill. And one is to create the CalCare system. The second, and this is a very high level view, is to create the CalCare board, which would help in short to administer the CalCare program. It would also set up a healthcare providers system of budgeting so that we know what it costs and what payments look like, et cetera. And then it would also be subject to financing. We still got to go out and get the financing, which was just spoken of. But look, here's what I would say though, in short, is that I don't think there's an argument about a broken healthcare system that we have today. I think the argument we're going to be facing is to make sure that this is done in a cooked way, as we call it, legislative policy, so that we actually do deliver on the things that we're saying. And look, we've got a long way in the process, but those are the kind of 4 pillars I think that we're taking a look at as we move forward. So thank you, Mr. Chair, and our colleagues. But I want to say one other thing. I do want to give props, or maybe I let Mr. Kalra, to all the LA members who have signed on to support. I don't know if you want to go ahead and say, Mr. Kalra, or you want me to jump in?
Go ahead. Yeah.
Sure. I'm not going to name all the people up and down the state. I should, but I'll name the LA members so that you can thank them for the support. And I'll start just off. I'll start off with Senator Lena Gonzalez. I want to continue with Ms. Carrillo, who's an Assembly member, Ms. Friedman, who's an Assembly member, Mr. Nazarian, who's an Assembly member, Ms. Luz Rivas, who's an Assembly member. And if I skip names, it's only because I either didn't have them on me or they're from Northern California. So I'm not exempting anybody on purpose. But I just want to talk relevant to the county committee that we're speaking to.
Sure. Well, that's the perfect segue. So we got a lot of questions on what I'm about to ask, but this is kind of along the lines of, and I appreciate you highlighting those members. And I know Assemblymember Friedman is also on this call as well, but I know she's coming back and forth. But what do you suggest, and so we'll start with you, Senator Santiago, is the best strategy to get some of your Democratic colleagues on board to support a single payer system? And how are we, or how should we work to navigate and work with the legislative leadership on this important bill?
Sure. Well, look, I'm glad you asked that, because it's, I'm going to paraphrase what my colleague now has said, Mr. Kalra, and I think we're taking this deep meaning to the approach, and this is a movement of love, right? So I think if you want to be productive, if you want to help the cause, I think you're going to advocate like you normally would on any bill. You can contact your legislator, you can request a meeting. I think the way to do it is we're going to do it as a movement of love. And I'll give you kind of an idea. When we did public banks, and many of the authors now mentioned earlier participated in that. What we did is we put our best policy arguments forward. And I think that's what we have to lead with, and that's what we're going to have to lead with now. And we're going to have to accept that there are policy differences between people, and there are genuine, when people have a genuine concern, we have to address it. So I would say that the way to do it is in a constructive manner. We're not going to call people out. I don't think that's productive in any way. We're not going to attack people. It's not productive in any way. The productive way to get something passed with a bill that is complex like this is to you can request a meeting. Like there's been plenty of people who requested meetings with me about bills. You can call and express your support. But I think because of the density of this bill, we're gonna have to lead with the best policy arguments and be tolerant and be accepting that people have different points of view and be able to address those points of view. I think that's going to be at a very high level one of the ways that we do it. But I do say at this point in time, we are presenting our best policy arguments and we're crafting the best public policy legislation. So I think the time right now is for us to get ready before those conversations begin.
So Assemblymember Kalra, same question, obviously, and you're the lead author of this bill, 1500. What ways are you navigating and working with your colleagues up and down the state, as well as with the leadership?
Well, I'm excited that we have a total of 20 of us that are on board with the bill. But I want to say something else. And Miguel, as a preface, Miguel mentioned it. First of all, this bill is the first step of many steps that have to occur before single payer is actually provided to the people. And people have to recognize that this is a huge endeavor. And when folks talk about fight, it is a fight because you have an industry that's literally making tens and tens of billions of dollars a year off of us and off of our people. But I don't see it and don't like to articulate it as a fight with our colleagues. And I mention that because we have astounding colleagues, some of whom have co-authored, some of whom have not, some of whom have stayed in a position, some of whom have not. And we have to be, first of all, above board and respectful, as Miguel said, of everyone's thoughts and opinions. This is not something like some random bill about like, naming a library where you say, yeah, I'll co-author that. This is a very serious endeavor that everyone has the right to ask the hard questions of me and other authors. They have the right to ask questions about funding and those kinds of questions, even though funding is a separate question from this policy bill. Obviously, on something of this nature, is something that's very important to have conversations about. I will say that the federal government, Congresswoman Jayapal, introduced Medicare for All 2021. Over half the Democratic caucus are now signed on as co-authors or co-sponsors, I think they say at the federal level, of that bill. The text hasn't even been released on that bill yet. And if it's anything like the previous bill, it didn't have funding in the bill either, because funding funding requires so many different levers to move, way more for California than it does at the federal level. And so what I would say is this, is that be respectful, be kind, be loving, recognize that it's not as simple as just saying, are you for single payer or not? It's not as simple as that. It's far more complicated when you pose the question of our colleagues, because they want to look at the language. They want to understand, what the path forward is. And absolutely, I'm committed to this. Look, I don't know how many years I'm going to be left in the legislature that I'm going to be here. This is not a one and done where I'm just introducing it. And I'm committed to spending the number of years necessary to make this possible. And if it happens down the line and someone else's name is on it, but people get healthcare, I'm fine with that. I don't need to be, I don't need any credit for this. Trust me, this is a lot more heartache than you think of putting something like this forward, but it's righteous. It's the right thing to do. I'm committed to working with the speaker and his staff on this in terms of identifying funding paths. A funding path may not necessarily be included in the bill, but we're going to have to find funding paths for issues regarding, it's not as simple as saying, well, we do spend more on healthcare now than we would under single payer. Every study shows that, even studies that have been commissioned by the state, that will save at least 10% or more. So we know the money is there, but it's not as simple as saying move it from box A to box B. No, it's much more complicated.
We're definitely going to get to that piece of it.
All right, yeah. I have a lot to say, obviously, but I would say when you approach folks, recognize that even if they're not there, those are our colleagues. I'm talking to them. I'm talking to a lot of our colleagues in a very respectful way. And the last thing I want to say on this is that a lot of our colleagues, and Miguel's on the health committee, our chair, Dr. Wood, has authored and gotten signed numerous bills over the years that have increased transparency, that have lowered costs. And so I would just say, remember that our colleagues are doing a lot of things on healthcare that have moved the ball forward. Every time that ball moves, it makes single payer more of a reality.
No, absolutely. And I think, Senator Kamlager, who is your colleague on the green carpet, as they say, just got to the red carpet on the Senate side. And so, I know you just got there, Senator, but what are some of the ways that you'll be working with leadership and your colleagues in the Senate, as you've been a champion on that? On the Assembly side, we both saw each other at the CalCare rally here in LA just a few weeks ago. So what are some of the ways that you'll work with leadership on that?
Well, so first of all, I want to give a shout out to now AG nominee Rob Bonta, and hopefully if he is confirmed to be our next Attorney General, that position will be a very important component of making sure that if anything gets challenged, once this bill is passed and signed into law, that we have an advocate in that position, in that department, to make sure that what we pass stays whole. So that's one thing I think we should recognize, and also just share some love with Rob Bonta. The other thing is, my approach is to be honest. We have had decades and decades and decades of a very warped, one-sided healthcare industry that has helped corporations and not regular folks. And so it would be very presumptuous to think that we are going to get it perfect in about 6 months. So I think that is important to say. I think it is also important at the same time to ask folks to take a leap of faith and to believe that this coalition that is together fighting for this, has in mind a bill that will allow us to all have access to healthcare that we can afford, that is free, where everyone is in and no one is out. People have a right to ask questions, and we actually have an obligation to say, I don't have all of the answers to those questions just yet. That is what policy discussions are about. That is what committee hearings are about. But what I do know is this is the vision and this is the outcome that we are all working for. And you do that as a member of a caucus, you do that as a member of a committee, you do that as chair, you talk across houses, you talk across your various caucuses, and you drum up support and you say, maybe I don't have the answers to all of those questions, but I'm going to work to get it, because at the end of the day, this is what we're working for. That's what we have to do. I've certainly been doing that, as now one of the newest member of the Senate, to say, hey, this is coming. And we, led by Mr. Kalra, we meet every week to talk about this bill, to talk about strategy, to talk about how we can make sure that we're being honest with stakeholders and constituents and the party, and also to make sure that we're being honest with our colleagues, and that we're having very robust discussions with leadership to say, this is something that is going to get, to your desk and is going to need your support. And look at how much we have galvanized both our own colleagues, in the Assembly and in the Senate, and also constituents from across the state to say this is something that we need. I also, one of the things I've done is I've started a health council focused solely on AB 1400. Jenna Harris is on it, Grace Barrios is on it, and it's to talk about the bill, it's to look at the language, it's to offer up suggestions, and it's to sort of talk about what it is that we all need to do to help make sure that we get it across the finish line. So I think that's something we can do on the outside, right? As well as the things that we're doing on the inside here.
Absolutely. And Senator, kind of on the heels of that, we'll start with you on this particular question. We did get a lot of ask on this, and this is kind of based on strategy, right? And what we can do here locally and working with all of our delegates across the state, but just activists who are not delegates and those who have an interest in this arena. But, what did we all, or you all, I would say we, learn from the last go around with SB 562? But what can we do differently this time around to make sure that we get more folks on board and get this passed?
I think we have to stop selling the idea that we have something that's completely cooked and that every single question you have, we have an answer to. We don't. But the one answer we have is that this is not working right now, and we have got to fix it. And it has got to be a complete overhaul. So you have to get on the bus. You have to put your seatbelt on. We are putting the pedal to the metal, and we are going forward. I think we really have an obligation to be honest. And that is where the stories and the testimonials come in about what's currently not working. Ash is right. There are so many other things that we're doing in anticipation of getting this passed. I'm doing a street medicine bill that says we're also connecting billable hours to providers so that healthcare providers can go out into the street and provide healthcare to homeless populations. We're doing things, Miguel is doing something around conservatorships for folks that are suffering from mental illness to make sure that they can get support. We are making sure that we're continuing to expand eligibility for folks with immigrant status or undocumented workers. We are doing all of this around the edges to make it easier, to butter it up for AB 1400 to get across the finish line. So we learned with 562 that you have to have an answer to the funding. We learned with 562 that it's okay to say, I don't have the answers to every single question, but I'm going to get back to you and I've heard you. And we learned from 562 that we cannot wait any longer.
Absolutely. Assemblymember Santiago, same question.
Yeah, and I'll be short because I know we've got a number of questions. But I think, look, what we learned is that we have to engage in a serious policy debate. And if there's one message I could drive home here to folks is that, yeah, on the inside of the building, we're going to have some real homework to do to outline what has already been said, including funding, which may not necessarily be in the bill, but maybe the next thing that we actually have to tackle. But also I think it's the way we build momentum and movement, right? And I think what we've learned is to be accepting of different points of view and to really have those answers as they pop up. I think I don't know that I've talked to anybody in the legislature who doesn't support a single payer, but they have genuine questions about where's the funding, how's this going to work? You're not answering this question, and I think what we have to do is to step back and if we're intending if we have the intent to do this, then we've had to answer those questions and be prepared with our best policy debates. And it's not so simple as to just point and say, well, it's going to get taken care of, or the money's already spent on healthcare, because the money is spent on healthcare isn't in the state budget to actually just turn around and make that happen. We've got to make the transition to actually make something like that happen. So I'm really excited about it. And I'll just come back and say, look, this is a movement of love. The best way to be constructive and to help the effort is to engage in a real serious policy debate and have a respectful conversation. I think that's the way that good work gets done.
And Assemblymember Kalra, same sort of question. What can we do? What can we do differently, or how can we work?
Well, one thing is, as mentioned, well, first of all, the actual bill itself. I mean, this is not a pamphlet. It's a 45 page bill. It has cost controls in it, which didn't exist in 562, which is a major component of it. Because I don't believe a real single payer program can exist without cost controls. And so the policy, I believe, has been improved upon. I really appreciate Insurance Commissioner Lara for setting the stage, but I think we have built upon that. I think that a couple other things is like, yes, there are certain questions that can't be answered because they're impossible to answer. I mean, even in the governor's commission, their initial environmental document laying out the problem, so to speak, says that a design of a system will help to answer a lot of the financing questions. Pramila Jayapal, the congressional bill, if they are able to use that to get leverage to lower the Medicare age 5 years, well, guess what? Single payer in California became that much more doable because now they're covering 5 more years under Medicare funding. If they're able to add money for assisted living and what have you, for long-term care, that also makes it more doable. So my point is that there's a lot of pieces that the more we work on, we have the opportunity to answer more questions. But I will tell you that a waiver under Section 1332, an Obamacare waiver, for example, under 1332, it requires a design first. A legislative in Vermont, they tried, and they actually got a waiver from the federal government to do single payer. The reason why they got it is because they got the legislature to pass a bill with the design. And that's, you have to work on these things at the same time on a parallel track, maybe not at the same pace, but you've got to work on a parallel track. And that's my argument to my colleagues is that, look, we can design a system and at the same time collectively handle these really big, difficult funding questions of which not all can be answered today because they're impossible to be answered today. But it doesn't mean that we don't design a system that brings healthcare to everyone.
No, absolutely, Assemblymember Kalra, and I really appreciate that. We have a series of questions that I'm going to ask each of the members who are on with us today, but we are very lucky to have from the Fighting 43rd Assemblymember Lara Friedman. I wanted to give Assemblymember Friedman at least a minute to say hello to everybody. She was also at the CalCare rally with myself, Assemblymember Santiago, and Kamlager. I wanted to give her a minute if we could spotlight Ms. Friedman from the 43rd. There she is. Hi, Assemblymember. If you want to take a quick minute to say hello.
Hi, I'm crashing. I'm like a party crasher.
No.
The party.
No, I was just on a neighborhood council meeting and I had this on my calendar. So I thought I'd just pop in. That's all. I want to thank everybody for being active, for being engaged. You're all incredibly important to all of us who are elected. And I just want to thank everybody and say hi to my colleagues. Hi, colleagues. Miss you, Sydney.
I'm still here.
Kind of. It's not the same, though.
No.
I feel a little abandoned, quite honestly.
Yeah.
Oh,
I feel a little rejected.
Well, this issue will bring you all together, friends. But on the heels of that, on the first question, and we received hundreds of questions, and some of them very similar, but we really appreciate the enthusiasm that not just from LA County, I mean, we've got questions from all over the state. So we'll go ahead and start with the Assemblymember Santiago with this question for you only, my friend. It comes from activist and friend Christine Chimzu and Leah Schwinn. who submitted similar questions. What actions will you take to support moving AB 1400 forward?
Well, number one was helping to author the bill. I think that was one. But the other really, I mean, all jokes aside, I mean, I think the most critical piece is to meet with internally with members one by one and answer the tough questions. I know I keep going back to that, but I think really that's the best way to get public policy done. It's a debate, it's a conversation, and we're going to have to do that. And I think investing the time upfront, which is what is starting to happen now, is going to be the best possible way. And I remember, I'll also tell you, this could take 9 steps. Meaning, or to go through the legislative process, because it goes through various committees and have to come back. And so we're in it for the long haul. I think the shortest answer, and I'm going to start off with again, the actions are meeting for me and our colleagues is meet internally with our colleagues and answer the tough questions and craft the best possible bill we can to ensure that we get one step closer to single payer.
Absolutely. And this next question for Assemblymember Kalra. This question was submitted by Miriam Ahmad. How do we overcome Californians' fear of higher taxes through intentional messaging and campaigning on this issue?
That's a great question. And by the way, about 80, the majority of Americans support single payer. About 80% of Democrats support single payer. That being said, that is before the onslaught of money that will be spent to kill it. And not just kill it, but as Miguel and Sydney said, these are several steps. Every step, they'll spend money to try to kill it, and a whole bunch of money. And one of the things they're going to say is, your taxes are going to go up. We've already seen this in some of the op-eds, and Chamber of Commerce already did a job killer thing. Oh, your taxes are going up, business taxes. What they don't tell you, and this is part of the messaging, excuse me, that we have to be really good at and clear on, is that we're already paying a massive private tax right now through premiums. The average employer spends about $20,000 for family coverage of insurance for their employees, and about almost $8,000 for individuals. That doesn't include the individual having to pay into that as well. That's a massive employer tax, huge. And so what we have to talk about is out of pocket, what are we paying? We already know we're paying more than anywhere else in the world. And in fact, California pays on average a little bit less than the national average. And it's because of things that we have done to improve access and to lower costs and on transparency. So we're taking some of the right steps. But the reality is that we have to get clear on messaging that we are paying more than anyone else in the world. And yet we don't have the best outcomes. Black life expectancy just went down 2.7 years. Latino life expectancy just went down 1.9 years. And so if we actually want to care about healthcare for everyone, then we have to pay into it. But the reality is that we'll pay into it far less than what we're paying now. And every study shows that, every single payer study shows that compared to a multi-payer system, private system with massive public subsidies. And remember, public subsidies are subsidizing a for-profit system. So when we say we're going to increase Medi-Cal reimbursements, what have you, what we're really saying is we're helping to subsidize a private system. So we got to tighten up that messaging, but there is a way to do it.
Absolutely. No, that's great. Senator, this question is for you, submitted by Shahrazad Shishigar. I apologize if I butchered that. Submitted this question: do we have a detailed plan as to how we cover startup costs?
Well, I don't want to get into, what detailed means for every single person. But what I will say is, yes. And so one of the things that I think each of us have been talking about is that this will allow us to position ourselves to seek consolidated federal waivers from HHS. So we also talk about CalCare and the CalCare Trust Fund. Once authorized and financed, the CalCare will be implemented actually as a comprehensive, universal, single-payer healthcare coverage program and a healthcare cost control system. The bill would create the CalCare Trust Fund in the state treasury consisting of any federal and state money that are received for the purpose of this act. And so initial funding would actually come from shifting resources from existing healthcare infrastructures to CalCare, especially the federal dollars, right? And so by 2023, because this thing is going to get enacted, yes, it will. Yes, it will. Then the board would be able to apply for waivers for all of the requirements. I think there's also language in the bill that says that the law will not go into effect until the Secretary of State, California Health and Human Services, determines that the trust fund actually has the revenues to fund the costs of implementing the title. So we are not just like, running out saying, oh my God, this is what's going to happen. And we don't have any idea. We're not thinking about how to get it started and how to get the revenue. We've actually started by thinking about how do we get the revenue and how do we make sure that we have what we need to begin to implement it, because we know that that was one of the biggest stumbling blocks of the last fight with 562.
And if I can add one last thing,
I was asking from the assembly side, if you can kind of tie that into that.
Well, just one last thing, because she was 100% on point. The federal waivers, especially the ACA waivers, require that you don't add to the federal deficit, but they give you a 5-year leeway into that because they recognize there are startup costs that may initially have a deficit, but eventually you get cost savings. So even the federal government in the waiver recognizes the startup costs of a program.
Absolutely. Well, this actually next question is for you, Assemblymember. This comes from Councilmember Al Austin in Long Beach. How does this legislation impact the future and mission of private healthcare providers?
So I love this question because you know what? If you talk to doctors, I mean, close to half the doctors now support a movement towards single payer. And there's a reason why. It's because the practice of medicine has changed so much and frankly has become quite miserable for a lot of doctors that practice medicine. I've had conversations already with CMA, the California Medical Association, and they agree that a lot of doctors, especially new doctors, are not enjoying the practice of medicine like they used to. And so when we think about private healthcare providers and their mission, first of all, do they really feel that they're kind of meeting their mission now? And both in terms of their quality of life and quality of being able to provide medical care, when many of them are on the phone with insurance companies for hours a day, far more than they actually see patients. So ultimately, I care about the quality of care, but also the quality of life of doctors and nurses that right now are so diminished. And the reality is that we do have provisions in CalCare that really focus on the providing of care, including private healthcare providers, to make sure that they're compensated adequately, that we actually give them the opportunity. Because right now, if you look at general practitioners, family doctors, internists, they actually are on the bottom. Pediatricians, they're at the bottom of the scale in pay. And that's not right. We actually should have an opportunity to say, how do we fairly compensate to get more doctors to move into those practices? We also have a way of taking into account rural doctors and underserved communities in urban areas where it's really hard to find doctors that practice there because they don't get compensated enough because they rely too much on Medi-Cal reimbursement. Mm-hmm. We got to flip the script on that. So absolutely. We are taking into account the quality of not just quality of care, but quality of life for doctors and those that are providing private care. Absolutely be taken into account the fact that, look, this is not government takeover of healthcare. We want those private providers to continue to provide, but we want to make sure we're providing the resources. And when you cut out the 20% of administrative waste that occurs right now in our system, not to mention the profiteering of the healthcare insurance industry, there's a lot of money there, not only to go to doctors, but to pay for their medical school loans, to pay for nurses loans. Those are the kinds of things that I want to do with the money. I want to make sure that we create an environment where doctors want to come to California to practice medicine, not to be on the phone with insurance companies 4, 5, 6 hours a day.
Absolutely. Assemblymember Santiago, did you want to answer that as well?
I think you did a good job, and I want to be respectful about the time. But look, here's what I do want to say, though. What I want to say is, and this goes to all the Democratic activists who are on this call, the members who have supported, who I've named, that we're extremely grateful for LA County Central Committee being the first one to stand up, really, and and support the bill and being in it for the long haul. And the chair's call to action that really did start all the county central committees up and down the state supporting the bill will be incredibly helpful to the movement. So I want to thank all the activists here who have been fighting for this for decades. I remember back when I first got in the business, and I'm going to age myself here, but early 2000s, when we were talking about single payer at the time, and we were getting kicked out of the Democratic Party because it wasn't with it. Now it's refreshing now to sit here and know that the Democratic Party is helping to lead these efforts. Some of the people who I'm scrolling around, I'm seeing some of the names, if you recall, standing out with the signature list, and when the first several bills were introduced, or I think it was Assemblymember Kuhl at the time who had introduced single payer back in the mid 2000s. But before that, many of you were out there with those sheets collecting signatures and trying to get a Democratic Party to support, and it was tough. Or some of the Democratic clubs across the county. And now we're here in a different situation, or you're helping to lead the efforts by coming on as an early supporter. And so we want to thank you and all the leadership from the LA County Democratic Party who's on here. And by leadership, I mean all the people who are on here, every single member of the County Central Committee who is helping to lead the charge, not just on single payer, but on other progressive issues that we have worked on through the years. So thank you.
Absolutely. And I appreciate that, Santiago. And as you mentioned, I mean, myself, when I first started volunteering in the party, it's Dr. Bill and Marcy Winograd and Susie Shannon and Dorothy Reich. I mean, you're right. There were folks who did laugh us out of the room on thinking on this issue. But the next question.
Well, you know what? I want to say this real quick. I remember when people thought Dorothy Reich had lost her mind when she was she was asking for support for public banks back like 20 something years ago. Now we just got a public bank bill signed in the California legislature with everybody who's on here helped get done. And it's the only one that's been signed or even made it to a governor's desk across the country. So we're extremely proud.
Another town hall idea on that. I appreciate that. But, on that, we've had a lot of activists who've been, working their butts off on not just this issue, but many issues. And a couple of folks submitted this question on the heels of Al Austin, but also Art Aguilar asked, what is the best response to a retired person who would prefer to keep their health benefits from their employer instead? And we'll ask Senator to answer that question.
Well, that question is, to me, reminiscent of folks who were really concerned about the Affordable Care Act and Obamacare. I want to, don't change. And, sometimes you just have to, I don't want to get evangelical, but you have to kind of go with God, and you have to understand that, everyone needs to be in the boat. My understanding is that every resident of the state can be eligible and entitled to enroll as a member of CalCare. My understanding is that this sort of collapses all of the sort of disparate providers and sort of entities under CalCare, and that you would not be and you're not going to lose out on any of the services or benefits that you currently have. So don't stay, come over. The water is fine. That is what I would tell that retired person.
No, absolutely. And that's true. And I think that is the fear. I mean, my mom asked me the same question about whether to keep her benefits or how does this work? So,
I mean, our goal is not to have some, truncated, fragmented system where folks are still falling through the cracks. The goal is to make sure that we're shoring up all of the cracks and even all of the craters so that everyone is able to benefit and get services through this new system. So I think the antithesis of this goal would be to have folks not come over and for it to be a system that is still civ-like so that folks fall through. That's been the problem we've been having to deal with now with our current system.
And that's continuously will be part of the strategy,
right?
On that. Assemblymember Santiago, I mean, folks, we got a lot of questions. I want to be respectful of everybody's time, but to kind of bring us home on this issue, and then we'll give some time back to the members as we wrap up. Last but not least, our final question was submitted by Isabel Story. Mr. Santiago, what are the biggest obstacles to getting this passed, and how do we overcome them?
Sure. Well, let me say, I think one of the things that we have to do, and I've said this before, I'm going to sound like a broken record, but it actually is the biggest obstacle is to make sure that we answer some of these tough questions and we craft the very best policy bill. Now, there will be some analysis that comes out on the bill. Potentially, if the bill is heard, it'll be in committee analysis, and there'll be some questions that we need to answer. And then we've also got a report coming out from CHBRP. It's an independent study that is done on the bill, and it will come out and tell us, what may be the strengths, what may be the weaknesses of the bill, and funding mechanisms to do. So I think the biggest challenge for us is going to be to make sure that we break through all the myths and misconceptions about the bill and actually sit down and talk about the details and engage folks in a very constructive way. And everybody here could help by remembering that what I started saying, right? This is a movement of love, and we treat people with respect and we engage in conversations. But ultimately, the biggest obstacle is breaking down the bill, sitting with people and walking through the pieces. And the funding mechanisms will be a challenge as well, because we do have to answer the question of funding. We do have to answer the question of revenue, and we have to answer the question of the GAN Act, which restricts the state to a certain amount of dollars in spending per person. So we're going to have to answer those questions, and those are going to be some of the biggest policy obstacles that we have.
Absolutely. And before we wrap up, I want to give a commercial break, obviously to thank our participants tonight. But we're not closing yet. Just give me 1 second. I want to be sure to remind you all that these incredible town halls were created by the staff. Drexel Hurd and Elizabeth Hennis, our leadership, Vice Chair Pat Sanders is on here. I know she's in the room, but it really is the staff who put this idea together. But it was the LACDP members, Ron Birnbaum, and like I said, Jason Spallon, Jenny Chang, and Betty Tomas Toto, and those of you who really do put in the work on not just this issue, but on a vast array of issues. So I invite you on April the 8th at 7 p.m. To participate and register for our next town hall with Supervisor Hilda Solis and LA City Council President Nuri Martinez for a conversation about the work the county and the city are doing on a range of topics. And all that information can be found on lacdp.org. /LACDP presents. So as we kind of wrap up, to give you guys, a minute and a half, I'll ask the kind of same question to Senator Kamlager. What are those biggest obstacles to getting this passed, and how can we overcome them?
I think we have to not be afraid. We have to not be afraid of the unknown, but we have to be so upset with the status quo that we are willing to jump in the deep end together. I would encourage folks to, have these kinds of discussions on your Zooms, at your Democratic clubs, engage, talk about the questions, be comfortable recognizing that there might not be answers to every single question, or that there may even be differences within your club with your members on how to see this through. But to continue to talk about it and to demystify it and to make people feel comfortable with change is really, really important. I also think it's important, one of the biggest obstacles is we always let the perfect be the enemy of the good. And I'm telling you right now, this bill is not going to be perfect. I have yet to see a perfect bill, but it is going to be good, and it is going to save people's lives. And at the end of the day, that is what we are all fighting for. So I'm really grateful that I am a member of LACDP. I'm grateful that the leadership is so strong and passionate on these issues. And I'm just asking us all to continue to talk about it, to raise the questions we don't have answers to, and to refine the questions where we do have answers, but want to dive even deeper. And I want to say, please, everyone, let Miguel know that even now that he has started to wear eyeglasses, that fine, and have no fear, because folks who wear glasses are cool.
There's so many jokes to make on that, but the man with the 2020 vision, Mr. Kalra, if you want to bring us home, my friend, what are some of those obstacles on getting this passed, and how do we overcome them?
Well, I had laser surgery many, many years ago.
We cheated.
So,
and that too will be covered, right?
Absolutely, that will be covered, and dental, and vision, and long-term care. And look, there are a number of really huge obstacles. I mean, there's no two ways about it. But that's what happens when you're trying to create systemic change, when you're really doing a massive system change that has been tried before. But you know what? it's been actually tried several times, many times over the decades, different states. It's been tried in this state several times. It made it to, the clear study of it made it to Governor Schwarzenegger's desk, was vetoed. But you can shoot 20 times, you make it the 21st time. That's what it's about. You have to keep on getting back up. And in this situation, I would just say, compared to last time, but we're pushing this forward with the loving movement. The sponsors have been phenomenal. The nurses have been phenomenal. We're doing everything above board. And I would just say, like, we have to continue this movement with kindness. It's got to be a movement of love. If people go negative, they go low, the attention goes there and moves away from the policy that we're putting forward to save lives and to bring justice and humanity to our healthcare system. And so, Nelson Mandela once said, it always seems impossible until it's done. And so this seems impossible. It really does. But I know that if we're committed to it, we can make it happen, because the system, the current status quo, the unconscionable, immoral status quo didn't come out of thin air. It was created by people. It was created by decisions that were made by legislators, by people in the private sector, public sector. These things happened over decades, and it's a system that builds on itself based upon greed and profit and pain and misery. I know we can do better. I know we must do better. And I know that if we work together, we can make it happen. I'm so grateful, Chair Gonzalez, and to the LA Democrats for getting on board early. And again, as we continue to talk to our neighbors and our family members, and as I continue to do do the best work that I can with my colleagues, let's recognize that this is not a one and done deal. It's quite the opposite. This is a journey, and it's a movement, and it's a movement of love. It's a movement of compassion. And I know together, together we can make it happen. And so let's keep that light bright, and let's follow it.
Can I just add that to Ash's point, this is also a system that was designed to create dependency upon it. And so this is our opportunity to break chains from this system and emancipate ourselves and create a system where we create healthy communities and healthy bodies that can be sustained without being dependent or codependent upon a system that's really designed to keep folks sick and poor.
Sure.
Absolutely. So, Assemblymember Santiago, we've got a lot of work we need to do. I know that you guys have other Zooms that you have to do, but in terms of the next steps, what are they? What can we do?
Sure. And I'll jump in here. So look, let's remember this. It's a 2-year cycle for a legislative process. So we have just begun the first year of a 2-year session. So sometimes folks ask, why is it held? It's normal that bills may be held or not held. I'm just saying that right now. But the processes that it needs to do when a typical bill goes through, let me just outline them very quickly. Number one, when a bill is introduced, it goes to the Rules Committee. From the Rules Committee, it goes to a Policy Committee. In this particular case, it would be Health. From a Policy Committee, it goes to a Fiscal Committee, which means Appropriations, unless it's referred to a different committee as well. It could be double referred, means to go to 2 policy committees. But let's just keep it simple for this. So that's Rules, Health, Appropriations. It would have to go to the floor. It would have to go to the floor, meaning the Assembly. It would have to go to Rules on the Senate side. It would have to go to a Policy Committee on the Senate side. We're assuming one. It would have to go to the Appropriations on the Senate side. It would have to go to the floor. And then if there's any changes, and there always is amendments in every bill, it would have to come back for concurrence. So we're taking a look at a minimum of about close to 9 steps before it comes back. So it is going to be a robust discussion. Now, if memory serves me well, by the end of April, any of those bills that are fiscal have to be out of committee and then on to where they are reviewed for a fiscal analysis. So we've got a little bit of ways to go in that conversation, but typically a bill will make it through the process within the 9 months, the 9 processes that I just mentioned. So it'll be a robust conversation. It is not untypical to see a bill go 2 years. I'm not saying this one will, but I'm saying it is possible. I've carried 2-year bills before. But just to be fair to the answer, we are at the beginning of a 2-year session. but it takes about 9 or so steps to get between here and September. Oh, and then the 10th step, which is the governor ultimately decide to sign or not sign. And Mr. Kalra, I don't know if you want to jump in.
No, I think you did a great job of outlining kind of what the process is. Thank you.
We've got our marching orders on those 10 steps and beyond, and we are certainly committed here. As most of you know, LA County is 1/3 of the voting base of the state. We are proud 3.1 million Democrats and growing. So thank you so much to Senator Kamlager, Assemblymember Santiago and Kalra, Insurance Commissioner Ricardo, Lara, and all of you tonight for participating. We really love doing these, so thank you so much. I know that everyone has to get to other Zooms, but thank you so much, sisters and brothers. We've got work to do. So have a good night. Thank you.